Welcome everyone. The webinar will begin shortly and it will be recorded. Connect with the campaign for grade level reading on social media. On Facebook, like the page Campaign for GLR, and on Twitter, follow the account at Reading by Third. Please use hashtag Learning Tuesdays and tag us to tweet anything you learn from today's webinar, and we'll be sure to retweet. We encourage you to share your questions, reflections, and observations on social media. Once again, we would love to connect. So on Facebook, like the page Campaign for GLR, and on Twitter, follow the account at Reading by Third. The webinar will begin in just a second. It will be recorded and shared with you afterwards. Okay, once again, welcome to today's webinar. My name is Sierra Sanchez, and I will be behind the scenes helping to produce this conversation. I have just a few housekeeping details before we get started. First, we would love for you to introduce yourself, so please use the chat box at the bottom of the screen to share your name, city or state, and your organization. Be sure when responding to select both panelists and attendees so that we all know who is here. All attendees are in listen-only mode, but we encourage your engagement by posting questions in the Q&A box. We will dedicate the last portion of the conversation to respond to the questions you post during the webinar. This webinar is being recorded, and a link to the recording will be emailed to all who registered. And we are streaming this conversation on our Facebook Live page as well. Finally, we will be posting a brief on-screen evaluation during Q&A and highly encourage you to respond. This helps us with our commitment to continuous improvement. Finally, before we start, I would just like to call your attention to our upcoming GLR Learning Tuesdays webinars. Later today at 3 p.m., we have the second part of Accelerating Equitable Learning Post-COVID, A Few Big Bets Part 2. Next week, we will continue our Learning Loss Recovery Challenge series with Accelerating Equitable Learning Recovery, District Chiefs as deciders, again at 3 p.m. Eastern Time. And finally, on June 22nd, we have another double header with Parent Coaching to Promote Kindergarten Readiness, co-sponsored with the Overdeck Family Foundation at 12:30 Eastern Time. And then at 3 p.m., Tools of the Mind, Key Steps to Create a Culture of Learning. We will post registration information in the chat box and hope you can join us then. Joining you now is Jenny Atkinson, Senior Consultant with the Campaign for Grade Level Reading. Thank you and enjoy the webinar.
Thank you so much, Sierra. I'd like to welcome all of you to today's Crucible of Practice Salon. This webinar series provides a deep dive exploration into how community coalitions are approaching and moving the work to improve the early school success prospects of children from economically challenged families, neighborhoods, and communities. Our goal is to illuminate the factors and dynamics that combine to propel progress. In each Crucible of Practice Salon, we hear from a community lead and other members of that coalition and community who speak directly to how they're doing this work and how stakeholders are partnering together to create momentum and synergy. We see these Crucible of Practice Salons as an opportunity to dig deep into the work that communities are doing and make more visible not just the what, but also the how, with the goal of learning more about what it takes to be successful, as well as how to replicate models that are working. We believe that sharing what we've learned and gathering in conversation will lead us all to do better work, get better faster, and grow to do this work at scale. I'm so excited about today's webinar, Readers to Leaders, Empowering Community in Dalton-Whitfield County, Georgia, where we will hear from a team of motivated coalition members who have, working together, are providing a continuum of services for families to take advantage of. And over time, they've seen grade level proficiency rates increase in reading. We are joined by Michelle Caldwell, Julia Clayton, Sharon Hickson, Stephanie Hogshead, Kimberly Mobley, Carolyn Woodson, and Terry Woodruff. We'll hear first from our moderator, Suzanne Harbin. For over 30 years, Suzanne has served in the Whitfield-Dalton community. In 2014, she became the Early Education Empowerment Zone Race to the Top coordinator for the Northwest Georgia region and the lead for the Get Georgia Reading campaign for that area. She is currently the director of the Early Childhood Initiative at the Community Foundation in Northwest Georgia. ECI strives to assure that children in their community have access to high-quality resources so they are ready for school and reading on grade level by 3rd grade. In this time, Whitfield Dalton has received state and national recognition and over $9 million in funding, including the PBS Kids Family Initiative grants. They also have been named a Pacesetter community by the Campaign for Grade Level Reading in both 2017 and in 2019. I remember the first time I saw Suzanne present at GLR Week, probably in 2017, and I was so impressed with her passion and commitment, as well as the work that was happening in Whitfield Dalton. And every year she and her team impressed me even more. Welcome, Suzanne.
Hello, everyone. Thank you so much, Jenny, for that wonderful introduction. And let me just tell you how thrilled we are to be with you today. The campaign has been with us right from the get-go. As you heard Jenny say, we started around 2014. We were Get Georgia Reading as our state campaign, and the campaign, every step of the way, we have learned so much and heard from other communities, the network, stealing from others, and then applying it in our own community. And so today, as we present, I'm going to tell you a little bit about Dalton and who we are, but then I want you to hear from all the others who are actually on the ground doing the work and the things they've learned and how well they have been received. So thank you so much. It's my privilege to introduce everyone to you today and to hear more. So let me tell you a little bit about Dalton, Georgia. We are located, if you know your geography, this is Georgia. You can see the highlighted part is Dalton. We are a rural metro area. I say that metro is metro because we have a lot of people, the population, 120,000 in our city. But then if I turn right out of my subdivision, I go into a city. But if I turn left, within about a mile, I have cows and pastures, and we're very spread out. So it's both a rural and unique rural and metropolitan area. We are about an hour and a half north of Atlanta, and we are about 30 minutes south of Chattanooga, right up 75. And if you'll look down, if you'll see the flooring under your feet, we are known as the carpet capital of the world. The city of Dalton and the county of Whitfield County, the carpet capital of the world. Over 90% of the world's flooring material is made here in Dalton, Georgia. So I can pretty much guarantee you that the floor underneath your feet was manufactured in Dalton. We're a large textile community and a manufacturing town. So we have a few of our key indicators that as we began our work, we needed to look at and to realize that we would shape our work around this. 29% of our moms, of the children who are born to moms, have less than 12 years of education. The moms have less than 12 years of education. From focus groups and doing a deeper dive, we began to realize that not only do our moms have less than 12 years of education, but oftentimes it's a whole lot less than 12 years. There's not a checkbox for a lot less. So 12 years, less than 12 years. So we have to do everything with a 2-gen approach. We have to look at educating mothers and families and parents and adults, as well as their children. 66% of our children under the age of 6 live in poverty, and 49% of our children under the age of 5 are either Hispanic or Latina. Self-reporting doesn't depend on race, but they are either Hispanic or Latino. So as Jenny said, we have been looking for outside funds to help with our work. Last count, it was $13.5 million. We stopped counting. Sometimes we recount, but it is a significant amount of money that has gone into our community around this work. And once we really got together and we all came together to form our collaboration, we saw the flywheel begin to really spin. And as I say, the proof is in the pudding, because our 3rd grade reading scores have exponentially increased from 2015. This is Dalton City's scores on their milestone. And in 2015, between 2015 and 2019, the entire system of Dalton Public Schools, the third grade reading scores increased by 8%. And so we were thrilled. And even in some of our highest risk schools, we saw double-digit improvement. So we were so thrilled to see those numbers. Likewise, in Whitfield County schools, which is our county school system, the increase was very good as well. It was 15% increase. And again, in our highest risk schools, the schools where people said, oh, those scores are always going to be low, or we'll never see a change there. That was not true. The truth was that when we did things that you'll hear about as our partners talk in a minute, the different things that we have done in those schools, that they also increased 15% overall as a school system, and double-digit improvement in all of our schools, our highest risk schools. And so we don't know what 2020 will bring. We did have our systems in place. When COVID came, we were able, when COVID, who knew a pandemic was coming? I used to say that no one could stop us, but the pandemic has really tested us and has tested our strengths. And so also our partners will report to you today about that and some of the systems. Thank goodness we had those systems in place, and how we've been able to adapt our work to also and continue to reach children in our area. So our first presenter is going to be Terry Woodruff. She is the executive director of the Anna Sue and Bob Anna Shaw Children's Institute, who work with children with special needs. And I'm going to turn it over now to Terry.
Thank you, Suzanne. What a wonderful initiative, and we are so thrilled to be here with you today talking about just the gains that we've been able to make as we go from readers to leaders. What we saw in our community was new families. We took a look at what was going on with the new families in our community. And our medical center, Hamilton Medical Center, had in the year 2020 had 1,628 birthdays. So that many children were born at our medical center. And then, as Suzanne mentioned, we began to look at what was the composition of those families. A lot of those babies were born prematurely. So you can see that and we were at the national average, 11% of our babies were born early. And some of them had low birth weight as well. So our parents were faced with babies who were sick or babies who were too small to go home with them from the hospital. And as Suzanne mentioned, we had moms who had less than a 12th grade education. This slide does break out from Whitfield and Murray County, but in Whitfield County, which is our primary service area, 29% of moms had less than a 12th grade education. And I think Suzanne also mentioned this, moms didn't have a box to check to say that they had less than 9th grade or even less than 5th grade. And we know through some of our community connections that we do have some moms who have had less than a 5th grade education. Then we also looked at what's the composition in our community, and we saw that it's almost a 50-50 split. 49% of our community was Hispanic or Latino, and the remaining 51% was non-Hispanic or Latino. And so what we saw was a community we had a lot of families. They were different culturally. They may not even speak our language. They were born to moms who didn't have a 12th grade education. And then the moms and dads were also worried about their children that were born either too early or too small to go home with them. So one thing that we thought was we wanted to be sure that we were able to connect with these families. You know, one of the things that Get Georgia Reading does is bets big on parent partners. And in our next slide, one of the things that we talked about doing was starting at birth. We actually had an aha moment, and we wanted to be sure that we were thinking, as we try to reach out to these families and we try to reach out to our community, how can we help them understand that the more words that they speak or they sing or they read to their baby, the faster their baby will learn to talk. And we wanted to know how we could reach out to programs that were already established. And so we reached out to a program that was established in Atlanta, started primarily at Children's Healthcare of Atlanta, and it was called Talk With Me Baby. And this happened through a connection that Suzanne made with Dr. Jennifer Staplewax when they were both attending a conference and a presentation. But we wanted to reach out because we knew that this was a collaboration between all of the entities that you see listed in the slide, and for the sake of time, I won't read them to you. But we also knew that this was an evidence-based program that could reach new families. And so what we did was we brought this to our facility, to our hospital, and to one of our outpatient facilities here at Hamilton Healthcare System. So we talked about how can we initiate this from birth so that we can connect with these families from the moment that their baby is born. And so we put this at our facility. We began doing some training. And on the next slide, you'll see some pictures, some examples of how we began teaching and modeling language nutrition from birth. We found that literacy is a very critical skill. And of course, early childhood is a very critical time for that skill to develop. So we began talking with the medical professionals who connect early with our families that were having birthdays at our medical center. All of the RNs and the LPNs and all of the units that connect with new families. So mother, baby, labor and delivery, and neonatal ICU. Each of these nurses have become models for Talk With Me Baby. And they simply present the information to the moms and the families that babies need lots of loving, supportive words, and the more you can talk to them, sing to them, and read to them. So we have books, as you can see in that top picture. We have books that are in Spanish and in English, and each family that has a new baby at our facility receives one of these books. And they are also taught about modeling the behaviors, the same behaviors that our nursing staff does when they're changing the baby's diaper. They talk to the baby about what they're doing. They reach out and hold the baby out and talk to the baby as they're rocking the baby or as they're holding the baby, just kind of narrating what they're doing and talking to the babies in the language of the family's heart. If the family speaks Spanish, they can speak that language to the baby as well. So we didn't stop there at Hamilton Medical Center. We wanted to be sure that we were also reaching out to children who were young and other families that may have some specific needs to be met. And we wanted to talk to families that were coming to the Anna Shaw Children's Institute. So we went to the Reach Out and Read program. Again, a connection that Suzanne made through some conferences that she attended. Reach Out and Read has 29 regional and statewide affiliates. They have about 5,800 program sites, and they focus on children from birth to 5 years of age. And what they do is they introduce and then re-emphasize reading from the medical care provider, and it's primarily with the child's pediatrician. But Anna Shaw Children's Institute had an opportunity to be the first subspecialty clinic to participate in this. And just in our first 6 months, we were able to give out 154 books to the children at Anna Shaw. We are preparing a report for January to June, and we think that our statistics will be even more than that 154 that we were able to reach in our first 6 months that we handed out the books. Just a side note, we opened in April of 2019. So one of the things that we wanted to be sure that we did was we got open and had things going, and then we joined the Reach Out and Read program. So we had been open about a year when we joined Reach Out and Read. And one of the things that they focus on in Reach Out and Read is doctors. So we talk about, well, why do we focus on doctors and why do we focus on medical professionals? Well, that's because 90% of children visit their doctor each year. And during the first year of life, they visit their doctor an average of 12 to 15 times, their pediatrician. Parents tend to trust their pediatrician, their child's doctor, and they will talk to the doctor about things that they won't talk to anyone else about. And then the doctor also works to our advantage when we're trying to teach children to read so that they can help model the behavior for the parents. Again, showing the parents why it's so important to read to their child, to talk to their child. And the doctors can use the tools as they're talking to the children and families to assess the child's development. Does the child know their colors as they get older? Is the child able to use a single finger point to pictures? Can they turn the pages? So all of these things are important, and it works to help with establishing those early behaviors in families so that they can understand how important it is to read to their child. Some of our takeaways or points to remember are that you have to think out of the box. You have to think about what can we do that's a little bit different? And that's what we thought about at Anna Shaw. We wanted to be sure that we were bringing programs to the children in our community that might not typically be brought to a subspecialty practice, but these were used in the pediatrician's office. And we also found that parents are twice as likely to read to their child if the medical providers and the nurses recommend that they read to their child, or that they look at pictures and point out the pictures and say the words. And we also want to encourage you to go for the ask. You know, our C-suite executives loved and absolutely supported the idea of Talk With Me Baby and Reach Out and Read. They thought it was a wonderful way to connect with the children and families that we take care of here at the Hamilton Healthcare System. And, you know, sometimes you think, well, we're not really education, so are our C-suite executives going to support this? But they absolutely did. And then from doing these practices, children's language skills can be accelerated by 3 to 6 months. We can't, and I know everyone on this call absolutely understands how important it is, but it's so important to help parents understand the influence, the positive influence that they can have on their children by participating in reading and talking and singing. And then we also want to be sure that we're modeling reading to children. That is oh so important. And then modeling it to families and emphasizing that, what we're talking about is success. We're talking about success of their family, success of their children. And then in this last slide, we know success is a wonderful journey, and each of these littles deserves the very best start.
Fabulous. Thank you, Terry. Such a great thing. I'm so glad you included in about the ask, because until we brought it up to the administrators at the hospital, they had no idea that these programs even existed. And it was much easier to get them on board than we would have ever have guessed. It took a while, but we just kept asking and kept going over the barriers. So thank you, Terry. My pleasure to work with you as well. And next we have Julia Clayton. And Julia Clayton, one of the things that we worked on in the state of Georgia was to create a quality rated system so that we would make sure that our child care centers had the highest quality available. It was a metrics to be able to measure the success, the high quality of our centers. And I'm proud to say that although we don't have a lot of different child care centers, we only have 13 in our area. The ones that we do have are quality rated. They've really worked hard. And Julia's center is the Whitfield County Dalton Daycare Center. And she has been very instrumental in helping her center become the highest rated, quality rated center that you could possibly get. And also they have just recently gotten their language and literacy certificate, one of only 8 child care centers in our state to be able to say that, to have gotten this language and literacy certificate. So now I'll let Julia tell you a little bit more about her center.
Thank you, Suzanne. It's an honor to be here today and be included with these other ladies that we work with so diligently to bring a firm foundation for these children as they move into the school system, not only with the children, but with their families as well. You can see by the next slide, there's some of our babies and how happy they are to be here with us. It's a joy to work with them and their families and to watch them grow. They're like little sponges at this age. And so it's such a miraculous thing to watch them develop and move through our center and into school. Let me share a little bit about us. We are a unique center in that we have actually been in this area in business for 50 years this year. This center began in 1971. I was not around then, but it has been around for quite a while. We do provide services for children of low income and working families. Also, the majority of our parents are also in school trying to better themselves and provide a better life for their children. As Suzanne mentioned, we are a quality rated 3-star center. We have been a center with quality rated a 3-star since the onset of that program. And so we're very proud of that, to have maintained that over the years. As a part of that, we were asked to participate and have received an endorsement for language and literacy, one of only 8 in the state. So we're very, very proud of that. Our teachers have been trained, have been going through training all year for that endorsement. And the assistant director and I have been taking classes through Harvard to try to make our program as strong as we can. We are a multi-funded nonprofit center. I think that's very important, and a United Way agency. United Way is an amazing organization, especially in our area. They're very supportive of our children and of our families. Right now we have 11 classrooms. We serve children 15 months through the pre-K year. Next year, I'm happy to say we are going to increase 13 classrooms and are going to do our best to serve right at 200 children. We are in desperate need of care, and not just care, quality care in this area, to provide these children and these families with the skills that they need to be successful in school. We right now are serving 156, but we are going up to 190 to 200 next year. So I'm very proud of that. A little bit about our families. You'll see a common theme. We serve a lot of single parents, a lot of single parent families, a few children raised by grandparents, but the majority of single parent homes. Those families, those parents are working or going to school, but they need us to help support them. The children are with us more than they are at home. And so it is our responsibility to really do everything we can for them. But not only that, but to help the families understand what they can do at home as well. So we do a lot of parenting. We do a lot of Zoom conferencing. We do a lot of face-to-face meetings. This year has been difficult. We've had to do those outside the center, but we've managed to do it. And I think by doing that, we've instilled the value of education in those families as well. We do have a very high Hispanic population. It's been very interesting to work with those families. A lot of those families don't feel like their children should be learning just English. They think they don't understand that they should also be learning Spanish. Children just don't become strong readers unless they're strong in their home language. And so we really work with them in both languages. We have many, many bilingual teachers here, and we actually have classes with our parents to teach them how to teach their children in Spanish and in English. So I think that's very important, that those reading skills will really come with that. Our income, you can see by the next slide, that our average is $36,000. That is pretty low, considering that many of these families have multiple children. Single moms raising 4 children, by herself. So it's important that we give them as much support as we can as far as parent education. We help them with financial classes. We help them to understand nutrition and the right kinds of foods to purchase. If we have families that are in need, we refer them to agencies so that they can get the help that they need. Children are not going to learn if they're not physically healthy. So we do work with pediatricians, with Babies Can't Wait, with our local school systems, and we try to provide everything that we can to them to give them the tools that they need to be successful. Our mission is a little long, but it just really hits to the heart of it. Our mission is to enable parents to continue employment and/or educational opportunities with the assurance that their child is well cared for in a safe and nurturing, stimulating environment. The ultimate goal of the center is to provide an atmosphere that encourages a child's self-esteem, confidence, and skill in order to be prepared for life experiences. Within us, we have several programs. I did mention that we are nonprofit. In addition to our childcare, we do have Early Head Start and Head Start, which are federally funded programs. We have Pre-K and Rising Pre-K, which are Georgia-funded programs, and before and after care is offered to all children in all of those programs whose parents are working and or going to school. Our fees are offset by United Way and by private grants and donations. So our parents are not paying much. Their fees are minimal. We have some children who are 15 months old and their parents are paying $35 a week for care. So that is just unheard of, in the private sector. So we're very proud of that. Let me speak to Rising Pre-K for just a minute. That program is designed for children that are bilingual, that are going into pre-K the following year. And it's all about language and literacy. And it's all about teaching the parents the skills that they need to help their children at home as well. Our curriculum in our 11 classrooms, we utilize creative curriculum. We believe young children learn best by doing. Through active involvement in their environment, children begin to enthusiastically learn about the world around them. Our educators maintain lesson plans and conduct ongoing assessments. They include observing and recording the children's work and developmental progress using the Bright from the Start milestones tools. We individualize for children, whether it be remediation or enrichment. I think that's very important because it's like I said earlier, these children are like little sponges at this age. This is the age where their brains develop and grow the most. We all know that. So we want to capitalize on every teachable moment that we can. Some of the next slides show some of the things that we are doing with literacy and with language. We're, again, very strong in literacy. We want children to understand that spoken word is written word, you know, that you can read words all around you, whether it be in books or on charts or in graphs or in magazines. And we also are strong with STEM activities. We want them to understand that exploration is a great way to learn. So science and technology and engineering and math are all incorporated into our classrooms. Every classroom, every age, every day we do activities. And you can see by these sweet little faces how excited they were. They love those marble activities. They love those. Experimenting with how to make that marble come out and go the farthest. As I mentioned earlier, reading occurs constantly in our center. And this is a 2-year-old classroom. And some of these they look big in this picture, but they're all 2-year-olds. And you can see that these children have been read to. They are modeling what their teacher has done. And I think this just speaks volumes for what goes on, you know, in our center. They all have a book and they're all just captivated by this little one that's trying to read this story to her classmates. We also do a lot with group and individualized projects to teach children to work with others cooperatively and also to work independently. So here's just some examples of some of the things that we have been working on, you know, this year. They love playing store, you know, reading. You can see words are in all of our classrooms. This was a great experiment. We try to think outside the box as much as possible. And this was a pumpkin volcano that they made. And they actually wrote about that activity probably for about a week. They were so excited about what had happened and wanted to share it. So we even shared it on Zoom with some of our families, which was great. That letting them be excited about learning is key to learning. And that's just so important. You can tell by those little faces how excited they were. These are some of our 2-year-olds, our 15-month-olds, and our 3-year-olds. And then on my last slide, I've listed some of the community partners that we work closely with. As I said, we do a lot of developmental screening. And it's so important for these children to be evaluated before they get to school. So we have many, many children with IEPs, with individual family service plans as well. A lot of our children receive physical therapy. We've worked closely with Anna Shaw with children that have autism. Her health department has come out and met with parents and met with families about ways that they could use nutrition in their homes to improve the health of their children. We want our children to be successful. And if they're not identified early with issues, then it's going to delay them when they move into school. We actively refer children. And we just can't say enough about these partners that we have and the services that they've provided to make our children successful. Our goal is just to give them that strongest foundation that we can. I want to leave with a quote. A child's life is like a piece of paper on which every person leaves a mark. We hope we leave a positive mark on our children and our community. Thank you.
Thank you very much, Julie. On my side, I love those speakers. You're doing
And such great work, and we are so proud getting those little ones ready for our next step. We are working on a cradle to career, the very youngest all the way up through college. And then on to adulthood. So our next presenter will be Caroline Woodison. She is with the Dalton Public Schools. She's a Community Solutions Director and works specifically with younger children. So Caroline.
Hello, can you hear me? Okay, can you see me? Okay, I can't see myself. That's okay. Thank you for having me here today. I just want to echo what Julia said before. It is a true community partnership. We cannot do this alone. Sometimes families and communities think that the school system has all the answers, but we don't. We need everyone's help, and especially with early childhood, we depend on the partnerships that we have in the community. About 10 years ago, we started seeing that we had a lot of children on our pre-K wait list who were just sitting at home. And so we developed what we call little cats. All of our mascots in our school districts are cats. So we started with our youngest, and you can change the slide. The design was to take the children from the pre-K wait list and have them experience a similar type of a day in a pre-K setting. They get to play with activities, they get to read books, they get to do things with their parents. We decided to have the parents come with them, mainly because we didn't have enough staff, but we learned so much from that it really helped the parents learn how to do things at home. It is funded through Title I, through parent involvement, and with some local funds as well. And it's led by our family engagement coordinators. We have learned that having the parents learn side by side, then they get to take it home and continue what they're learning. Next slide. We focus on the main things that get them ready for kindergarten: cutting, pasting, gluing, coloring. But we also focus on, as Julia said, bilingual, because our school district is 70% Hispanic, 30% English language learners. And so a lot of the parents were waiting to have the schools teach English because they were afraid that having Spanish in the home would slow the children down in the learning the English. But we have made a commitment to teach these parents that having two languages in the home is really a strength, and that they can have that as an asset instead of a deterrent. And so it has been a great learning process for everybody. The format is learning through play. We do a lot of hands-on experiences. We do music and movement. We do the social, emotional, and healthy snacks. You can switch the slide again. And we have overarching themes. Looking at the big picture, we look at welcome to school, fall, and spring, and we do all the activities with the parents. The third thing that is critical with the little cats is that we have celebrations. We do once per quarter a great big celebration. We realize that a lot of our families don't have the same experiences. We do have high poverty, so they don't go to the ballet. They don't go to the Creative Discovery Museum. So we take field trips once a quarter. It helps, again, teach the children and the parents. It teaches social skills. It gives authentic audience, and it gives communication opportunities so that both the parents and the students can learn both in English and Spanish, and everyone has a wonderful time. And it gets them ready for the kindergarten experience. The next thing I want to talk about is our Dalton Neighborhood Initiative. This, it's interesting, the grade level reading Learning Tuesdays just a couple weeks ago had family resource centers as a highlight. And this is what we did in our Dalton area. We have an area of a housing development, and we saw an open, abandoned resource center. And I told Suzanne one day we were driving around, I said, we can flip this building and we can make it something that can be meaningful to the families. And we peeked in, and it had rats and boxes and chipped paint and asbestos. And Suzanne said, oh my goodness, I don't know about this, Caroline. And I said, trust me, we're going to do this. And so it took, again, the community partnership. We wrote several grants and we had several businesses that supported us, but we turned an old abandoned building into an adult learning center for our families and totally refurbished it with some, I'm pretty sure it's Shaw flooring on the bottom. We have classes there for both the adults, our parents, and our students. We have computer skills classes. We have literacy classes so that the parents can learn English. We have cooking classes, and the cooking classes are really focused on healthy eating and learning how to read recipes. It's amazing how many families just don't know that skill anymore. And so we are teaching the families. We also have a health aspect to it, where we are looking at first aid and CPR classes, as well as we surveyed our parents. What questions do you have? What do you want to learn? And overwhelmingly, our parents asked for over-the-counter medicine training. It is so confusing to go into a pharmacy and see a whole wall of antihistamines or cold medicine. And especially when they don't always know English, that makes it even more difficult. So we're having classes of what do you give your med? What do you do? When do you go to a doctor? When do you just get some cold medicine? And one thing that Suzanne is going to talk about a little bit later, we partnered with the local technical college and started offering child development classes. So this center is being used for all kinds of different things around, focused on this community and their needs. Next slide. We also have opportunities for our children because that is our focus at the end of the day. In the summer, we have a welcome back to school, and it's where they can get books and get school supplies that they need and introduce them to the classes that are going to be held during the year. Over the summer, it is so critical that we do not have that summer loss and learning loss. And so we have tutoring classes at the Roan Resource Center, as well as summer pre-K classes. And we have a great opportunity in our community where our literacy coaches take a school bus and take books around to children. It's called Big Red Reads. And we take, on a weekly basis, we take books to our lunch sites, our lunch feeding sites, and help get books into the community and keep children focused on reading and learning throughout the summer. And that's it for Dalton City Schools. Thank you.
Thank you, Caroline. What a fabulous and just fabulous work. I'm just so honored to be with everybody. I'm so glad to share it with everybody. Our next presenters are Michelle Caldwell with Whitfield County Schools, and also she is over elementary education, and then Dr. Sharon Hickson, who is the Dean of Education at our college here in Dalton. It's Dalton State College. So I'm going to let them tell you a little bit about the work and the ways they incorporate early education into their work.
Thank you, Suzanne. Good afternoon, everyone. I'm Michelle, and Dr. Hickson and I are going to share some of the innovative ways that we've collaborated, capitalizing on our community partnerships and utilizing grant funds. And I can't reiterate enough what Caroline spoke about as far as community partnerships. If you are attending today on behalf of a school system, schools can't do it alone. We refer to a lot of our initiatives as beyond the classroom. Our teachers and our administrators are doing all they can during this school day, and they're doing amazing and wonderful things. But with the poverty and second language learner communities that we serve, it's going to take a little bit more. On the next slide, you'll see some of our key takeaways. So what we're going to focus on, we'll have 3 key initiatives that we'll speak to, but throughout these partnerships, here are some things that we've learned. First of all, I'm going to go back to one that was mentioned earlier. Don't be afraid to ask. Everybody is probably not as fortunate to have a Suzanne Harbin in their community. But we call her the glue of all that we do, and she is not afraid to ask. So if you need an asker in your group, just make sure you get one. So our key takeaways will be, it's a whole lot of work, but the payoffs are big. Communication and relationships are key. Using data from all stakeholders is important for success, and true collaboration is essential. What we've used to kind of target our work or help keep us more focused, on the next slide, you will see what's probably familiar to most of you guys is the Get Georgia Reading Pillars. This had really helped us focus our work and get our priorities in order. We knew we wanted to help children. That's the heart of everything that we do. But in order to get grant funding and get ourselves more focused, these pillars have been just invaluable. And you will focus on 2 of those today. Primarily, our grants focus around language nutrition and access to print. Those are 2 of our main priorities that we've included in our work. The 3 activities that Dr. Hickson's going to share with you, we're going to talk about learning academies, power lunches, and literacy camps. Dr. Hickson, I'm going to turn it over to you.
So on the next slide, you will see some discussion of our learning academies. These are parent-child workshops that are delivered by our School of Education faculty who have an expertise in literacy. What we do is we recruit pre-service teachers or our teacher candidates to assist us, and we gather and organize all of the materials. And those materials include books to go home every evening with the children after they participate in the activities with their parents. And we send all the materials that they may need to have at home to do homework, although we don't call it homework. We send it home on a choice card. And so we don't assume that any of our parents have any materials down to a pencil. If we want them to use a pencil, we will send those pencils home with the children. And so the payoffs have been really big for us also at Dalton State College. It gives our faculty recency of experience working with children in the schools. It allows our candidates or our pre-service teachers to learn how to work with parents, because parents are somewhat scary for them because they don't get very many opportunities to work with parents until their student teaching semester. And they do get to learn about the lived context of the children.
And the payoffs for a school system, if you have a community college or a college nearby, it is a gold mine if they have a Dr. Hickson on staff. The payoffs for the school system is really, it helps empowers our parents. We want, we have the children during the day, but we need to empower our families to help their children at home. So that's one of the big payoffs. And another thing they get to have modeled for them during these sessions is behavior management. A lot of times our families say they can't do anything with their kids when they get home. Well, it gets modeled for them how to hold that structured environment, how to make sure that they support their children at home.
So on the next slide, you will see some pictures of our teacher candidates in the middle of a grassy field delivering science and literacy lessons. So pairs of teacher candidates are recruited and trained on our campus to develop the lessons and then deliver the lessons. And they are responsible for the delivery of the lessons. Again, we gather all the materials and books that the teacher candidates are going to use, and we send all of the supplies home with the children that attend. We might have 20 children at a site. We might have 60 children at a site. You can see that in the background, they're sitting under a like a tailgate party tent, for lack of a better word. So the payoffs are really big for Dalton State College. Our teacher candidates get more practice developing lessons and delivering these lessons. Here, the teacher candidates really understand the lived context of the students' lives. They are literally in the communities delivering these lessons. They're in a grassy field, they're on a person's porch, they're in someone's backyard. And we believe they're developing great classroom management skills. They're not in a classroom here, but if you've delivered a lesson out in the hot sun in June and July in the state of Georgia, and you have dogs, cats, and chickens literally running through your lessons, then classroom management in 4 walls has to be easier.
Absolutely. This probably is TMI, but we have watched a dog mark his territory on everybody's materials outside of the circle. So You're doing a fabulous job. The payoffs for the school system, of course, is helping reduce that summer slide. We want to continue that excitement and love for reading throughout the summer. And what we were finding is a lot of our children who live in poverty go home for the summer and they don't get to leave. They don't have access to the public library. They don't have access to books at home. So during all these activities, we make sure that students go home with books in hand to help build their home libraries. It's just a fabulous way to continue learning throughout the summer.
So on the next slide, you will see our summer literacy camps. Summer literacy camps were born a little bit later in our collaboration with Whitfield County School. And this came to be because one of our literacy faculty members wanted our teacher candidates to have experience working with children in an authentic situation. And she came to me and said, is there any way you can find me some children to work with in the summer? So I reached out to Michelle, and probably within literally hours, we had principals jumping at the chance of having summer literacy camp on their campus. So our teacher candidates design the lessons for the children that are going to be participating in the summer literacy camp. Our faculty select the books to be used and the focus vocabulary. We order all the books and materials, and again, books and materials and a choice card go home with every child that participates, and they're given opportunities to complete homework, again, not called homework. And our candidates are coached. So our faculty walk around and they go through each room while the teacher candidates are delivering the summer literacy lessons, and they coach them, they take notes, and then they debrief with them and talk to them about what went well and what they could do differently. The payoffs are huge. Our teacher candidates often talk about this being one of the best experiences they've had throughout our entire program. They get to teach without fear of assessment. So while they do get coached and somebody is watching them, they don't have certain benchmarks they have to meet, or they don't get to move throughout to the next step of the program like they do in their regular field experiences. So they feel free to be creative, and they feel as if they're the teacher of record for the 2 weeks of this literacy camp. And they get a real good sense of how much work teaching really is, because they're responsible and they want more hours. That's what we're hearing, is that they don't have enough time. So the payoffs for our faculty, again, is that they also are getting to work more closely with teacher candidates and more closely with children in the schools.
And of course, if you're from a school system, you can see the fabulous impacts for our kiddos. This is masked as sort of summer school, what we all remember summer school, but we're not able to, we don't have the funding for that anymore, but we mask that with a fun name called Literacy Camp. And our kiddos get to learn throughout the summer, and we just provide the location and help recruit students. So this is a beautiful partnership. So if you have the opportunity to partner with a college in your town, I highly recommend. This is an untapped gold mine that we have not seen or realized. On the next slide, we're going to finish up with our key takeaways, what we've learned. Sharon?
Sure. So as you can see, this is a lot of work, but the benefits far outweigh the work. So Whitfield County Schools and Dalton State College both have benefits. Whitfield County's children and families have experiences and growth, and so do our teacher candidates and our faculty. So it's a win-win for everybody. We definitely feel like open lines of communication are essential for programs and projects like this to work. We make sure that all stakeholders are included in our communications. We couldn't do this without including the principals and the staff at the schools in our discussions and our meetings, nor would this work if we didn't include our faculty members and staff on our campus in the work.
We have constantly used data to inform our decisions. We have an amazing evaluator. Data drives our decision making, and we've used that data to be able to make mid-course adjustments and improvements in what we're providing to families. We have monthly meetings. Sometimes we adjust things right in the moment because we want to make sure we're doing everything we can do to impact children and families. And the last one, our true collaboration. We didn't get here in a hot minute. It has taken some time. We have great collaborative conversations. We text in the middle of the night. We've had phone calls. It is super important that your group just is close, that you communicate, and then you can have those conversations with constructive feedback to make sure that your initiatives continue to get better and better. We're super proud, of course, of our reading data, but I'm reminded that behind every one of those numbers is the face of a child, and that's what keeps us all going. Thank you.
Thank you, Michelle. I appreciate it, Michelle and Sharon. As you can see, they work really hard, and in the summer especially, to put together these programs and just to keep going with it. We just kept started out with a small step forward, and then it just has increased. Each thing has led from the next to the next. And so now Stephanie Hogshead, you've already heard how involved the United Way is in our community, and we're so thankful to have their partnership. And Stephanie Hogshead is with the United Way, so she's going to tell us a little bit about her efforts, additional efforts in the community besides what they already sponsor.
Thank you. And I'll just piggyback on everything those before me have said of what an honor it is to work with this group and collaborate with this group on a weekly, daily, Michelle said sometimes in the middle of the night, text messages when we wake up and something comes to us. But it has been fabulous to collaborate and continue all these efforts. And I came to United Way and the nonprofit world via education as an elementary school teacher. So the fact that I get to continue to work with this group and fuel my passion for literacy and early learning has been just a wonderful aspect of continuing that piece of my career. But I wanted to share with you guys a little bit about our power lunches. And I know Dr. Hickson just spoke about that, but I'll kind of give you a little bit of the background and the history and tell you how that tied into what we call the power lunches. So this effort started about 10 years ago. And Caroline spoke a little bit about the city school system had Big Red Reads. And I think a group of volunteers were inspired by that effort and thought, hey, we have summer nutrition sites in Whitfield County schools. Let's see if we can get some community volunteers to go out to a few of these sites and be there when the families and children are receiving their lunch and give away free books and be a happy face to greet these families. And so that is how it started. And then Dalton State College kind of decided, hey, we can take this a step further and involve our teacher candidates. And so Dr. Hickson has continued that work with several of the sites. So they still call it power lunches, but they take it a step further and do their great lessons and plan those every week and still give away the free books on top of the lessons. But I have continued to mobilize and organize the volunteers and the community volunteers and the books and kind of all the technical issues, but it cannot be done without the collaboration with the school system and Michelle and everybody on this group that helps out. But we kind of started with just about 10 or 12 sites. And then last year during COVID, we were not sure. Kind of like Suzanne said, we had some things in place. So we were happy that we were able to kind of very last minute, like I looked back in my email and there was one on like May 26th. We're like, yes, we can finally do this. And it started week after that. But Michelle called and she said, well, how about we do like 30 sites instead of 10 or 12? So we set our goals high last year. And thankfully we had some grant money to buy brand new books. In the years past, we had kind of done book drives and we had done used bookstores and anywhere we could get books from, but we were thankful to have grant money to purchase new books and continue those larger number sites. So last year for 2020, we were able to do our 30 sites. We gave away about 4,700 books total. And we had some great community volunteers as well as our Whitfield County Schools elementary sites that were lunch sites. The teachers and principals and their staff volunteered every week. And so you can see, I thought pictures really tell the story so well. You can see the happy faces of these children and volunteers that are giving away the books. But But there again, this is something easy. And I think I would just say, if this is something you think you can do, start small. Just say, hey, we're going to do 3 to 5 sites this summer. Because the books, that gets to be the little bit of the stressful parts, making sure we have enough books. And so, which is a great problem that we have so many that want books and come to the lunch sites. But I would say start small, and then each year have a goal to grow it a little bit. And the grants are key in collecting your data and being able to get some funds to purchase the books. And the other piece of my work with this group is something that we call Book Blast. And a little bit of history on that. This actually started as a community celebration that was like a free, almost like a back to school fun celebration, where it was held at our local community center. Free books were given away. We had music and reading circles and book characters, and it was just a fun, free family event that continued for several years. And when Whitfield County Schools received a grant from the state of Georgia, we kind of thought, hey, why don't we take what we do for Book Blast on a smaller scale to some of our schools? And so I would partner with those schools on when they would have their family night events. And I would go and set up a table. I had book character costumes and books to give away, crafts, reading circles. We had little backpacks. We had all kinds of stuff. And so it was just a fun way to be out in the schools and connecting with the parents and the children. And kind of, as Michelle spoke to, we're able to kind of, for COVID, adapt this as well. And we still had several schools that we needed to serve. So this year, and you can see the picture of Suzanne and I there with the cart and Pete the cat. Instead of partnering with their family nights, we went in on a school day and actually went to every single classroom in the school with the help of the media specialists, the literacy teachers, the principals. We organized that, and every child in those schools got a free book. Plus we had Pete the cat with us. And I think on the next slide, you'll see a few more of those pictures. But, this was, I think, something we have already had going, and we tried to just think about how can we continue this work or make it work on a smaller scale for our schools or our parents and families. And so it's been I tell you, not being in a school for over a year, Suzanne and I left that day and we had like the most fun we'd had probably in a year, because we got to see all the children and the teachers, and the kids loved it. And Pete the cat's always fun to take around. So I think there again, the takeaways for all of us is always the collaboration and communication, and being able to work with the principals and the staff at the schools to help those events run smoothly. But I'll be happy at any time, or email afterwards if you want to know some of the technicalities and nitty gritty about that work. But like I said, I felt like the pictures share the happy faces and positive outcomes of that work.
Fabulous. Thank you, Stephanie. One of the things you'll see, a common theme, we're all about books, giving out books as best we can to these families. When your children live in poverty, buying books are expensive, and buying books is a very difficult thing for these families, especially if education is not important. As we've already told you, that is an issue in our community, that the families don't necessarily have a good experience with education themselves, the parents don't. And so we needed to make sure that we want to have our families to have their home libraries and the children to have that experience. So that's very exciting. Thank you, Stephanie. And now, in the middle of all this, at a campaign for grade level reading conference several years ago, I heard about PBS Kids and the Sesame Street and how important that connection could be. And I came back and realized that we needed to work with Georgia Public Broadcasting. And so I don't even know how it all came to be, but it came to fruition. And there was a grant we wrote, and we were able to be selected for that. And so a phenomenal partner. Cannot say enough things to you, tell you how fabulous it has been to have Georgia Public Broadcasting become a part of our work in our community. And so I'm turning it over now to Kimberly Mobley, who is the Early Education Director for Georgia Public Broadcasting. She's going to tell you a little bit about her work and what she's done in our community. Kimberly?
Thank you so much, Suzanne. It is indeed a pleasure to be here today. I have about 7.5 minutes or 7 minutes to tell you a beautiful story that has morphed into this butterfly of a partnership with the Dalton community. So I'm going to jump right in and get started. So we developed a partnership with Dalton community under the PES grant. You'll hear me refer to it as the PES grant, but it's actually the Parent Engagement in Schools grant, which is funded by PBS Kids. And so the grant supports the development of innovative educational television and digital media targeted to preschool and early elementary children and their families, with the general goal of promoting early elementary learning and preparing students or children for kindergarten, with particular interest in underserved communities. And so that's really how this partnership started, in meeting the ladies that you've already heard from today. Next slide, please. And so we kind of jumped off around April and our very first community partners meeting. And the very first time that I had the pleasure of meeting Suzanne, and it was the community foundations and Dalton Public Schools, Northwest Georgia Regional Library, Whitfield County Schools, the daycare center there in Whitfield County, and the Anna Shaw and Bob Shaw Foundation. Next slide, please. And we all decided that we needed to come together to discuss strategies for how we would be able to provide these PBS Kids resources for the Dalton community. And so, of course, Suzanne had this wonderful idea of a press conference, and the relationship started. And I often tell those that I work with at PBS Kids and Georgia Public Broadcasting that this is it's really indeed a relationship where we started off what I believe was like courting one another. And that phase was getting to know one another, getting to know the families, becoming familiar with the resources that were already in the Dalton community. And what we did not want to do here at GPB, we didn't want to begin to throw a whole bunch of just resources at Dalton. They already had established this wonderful community where they already had resources. You all have already heard of all of the literacy programs and all of the work that has gone into promoting literacy for early learners. And so we just wanted to be able to be a part of that work. Next slide, please. And so that initial press conference really introduced GPB and PBS Kids to the Dalton community, and off we got started. Next slide, please. And so that work really started with the planning phase. Next slide. And so that planning phase just really honed in on our needs assessment. PBS Kids provided a needs assessment for us to think about how would we gather information from the community, what information did we really need to understand more, and what were already the strengths of the community. In the next slide, you'll see that a part of the results that we received from that needs assessments were that the community parents and families let us know that two-way communication was important. They wanted to be able to connect with the school just as the school was connecting to the home. They wanted to feel included. It wasn't that the Dalton schools or Whitfield County schools did not make them feel included, but they wanted to know how could they become more engaged as families. They wanted more personal interactions with the Dalton community. And they recognized as families and parents that cultural and socioeconomic barriers were present. And so we want to be able to continue to provide resources to bridge the gap for all of these concerns that parents have provided to us. Next slide, please. As a part of the results, we also found out that some of the parents believe that some of the school activities may not have been at locations that they could get to, that the community had strengthened values and they wanted their basic needs to be met. So before we could provide books or before we could provide family community learning workshops, the families asked that we meet their basic needs. And that's what we've set out to do. Next slide, please. So we have Planned activities, family and community learning workshops. We've planned Appy Hour, Literacy Let's Read, Parent Talks, and PBS Learning Media. Most recently, we've kicked off those family and community learning workshops with the Dalton community with Ready, Jet, Go. We've done Cat in the Hat, Molly of Denali, which are all familiar characters of PBS Kids, and the Dalton families have been having a ball. We've already conducted Appy Hour, which is really 1 hour of providing an app to families virtually now, so that we might be able to extend learning from what they may be learning in school, or be able to help those families to understand that all of PBS Kids apps are actually linked to a curriculum or content area and social emotional learning. And so we want to be able to provide families with the opportunity to co-view and to really have exciting times with those families. And then we're going to be kicking off Literacy Let's Read. We've already done some of that work in Parent Talks and reviewing PBS Learning Media with the Dalton communities. Next slide, please. So the activities that are coming up for Dalton community are as follows. Next slide, please. All right, so Cat in the Hat, Ready, Jet, Go, and Molly of Denali. Actually, right now, we actually have the Ready, Jet, Go FCL that is going on with our collaboration with GNTC and those families that are there. Sesame Street and Communities, we're going to talk a little bit about that. Appy Hour and Literacy Let's Read. Next slide, please. So our very first event that we had with Dalton was the Sesame Street celebration. And we started off with a sort of like a professional learning for all of the stakeholders for Dalton community, which included Dalton Public Schools, Whitfield County Schools, parent mentors, counselors, Anna Shaw Foundation staff. All of us were there to really talk about how we could look at trauma and addressing adverse childhood experiences and providing resources. And after that, we had a huge celebration with more than 1,000 families and participants from the Dalton community. Next slide, please. This was the 50th anniversary for Sesame Street, and we decided that we wanted to celebrate with Dalton. And that's exactly what we did. So the next few slides, you're going to see a few pictures from that celebration. And then you're going to see some photos from the family and community learning. And as they're moving those slides, I want to tell you just one moment, the family and community learning workshops are an opportunity for us to meet with families each and every week that are based on a PBS Kids character. And so we meet once a week for 1 hour. We provide dinner, snacks, we have hands-on crafts, and then there's a learning component. And then they actually make something to present. So it may be focused on sorting, or it may be focused on STEM activities, but whatever they're learning, they will receive a book and they'll take something home with them each and every week. At the end of the 4 weeks, each family that attends will receive a PBS Kids Playtime Pad, which is really exciting for all of the families. Next slide, please. And so we found ourselves in the middle of a health crisis with COVID. And we said, okay, so how do we continue to provide these resources to the Dalton community? And how do we continue family engagement? In the next few slides, you'll see that we decided to continue to provide these resources with Dalton through collaborative community planning. And we started to recruit families to join us virtually. And we just continued on with the FCLs, and we've been having an awesome time virtually. Coming up soon, within the first week of July, we will be having our very first face-to-face camp since COVID actually started. And that will be happening with Dalton City Schools. And so we were absolutely excited. So we're just really focused on retaining families. Next slide, please. Retaining families into implementing the activities. We provided virtual Appy Hour, a virtual Literacy Let's Read. We provided digital backpacks, over 100 backpacks to the Dalton community: book bags, pencil pouches, school supplies, and we are totally enjoying this relationship that we have with the Dalton community. This grant started in October of 2019, and we will go through February of 2020 and beyond, 22 and beyond, and we plan to be there in Dalton as long as they will have us. And that's it for me. Thank you so much. And if you have any questions about this partnership with Dalton, feel free to put those in the chat or email me if you have any questions. Thanks so much.
Thank you, Kimberly. Yeah, I love what Kimberly said about the relationship building. Everybody knows Big Bird. We had one of our collaborative meetings. We had a slide with all the different Sesame Street characters, PBS characters, and amazingly, almost everybody, a room full of 30 people, chose a different PBS character and what it had meant to them and why they had selected that particular character as their favorite. So it's been a phenomenal resource. People are so excited about it. Kimberly, as she says, she started to build a relationship. Our last Molly of Denali family learning, community learning session filled up immediately. Like as soon as we could announce it, people had filled up for it and signed up to register, and we had to put in an additional session. So it is building, and we are so proud of that. That one relationship we are having with GPB. So they've been great. And then I'm going to finish up very quickly. One of the things that we have come out of all of this work is a connection. You heard Kimberly mention GNTC. That is Georgia Northwestern Technical College. Here in Georgia, we have a technical college system. It's like Vo-Tech, and I can't describe it to you except to tell you that it's after high school. It is they do things like welding and all kinds of different programs that can be useful in the workforce. And so we did some research. We had a hunch that young children would be part of that, but we weren't really sure. And sure enough, as we conducted a research report and a survey of the students, and we found out that, yes, in fact, the students are parents, that over 50% of the students at Georgia Northwestern Technical College are student parents. So they do have young children. 78% of those children were under the age of 6. So I was like, bingo, we now have our target audience. The majority of those students said that their children were not in organized childcare. So they weren't being reached by traditional methods of ways that we could get to them. So we have really worked to build relationships with them on their campus. And so this is actually, there's 2 Head Start centers that are adjacent to the GNTC campus. They got together, they helped us. These are the activity kits filled with school supplies that we gave out last year. COVID shut us down, and we were able to do a drive-by. If you'll go through these slides pretty quickly, and I'll show you. Those are their activity kits. We gave out diapers. As Kimberly said, reaching out to our families with their essential needs is very important. The survey showed us that most families, most students were experiencing some stress. By the end of the month, they were running out of resources. So we did this, and we also partnered, next slide, with the food bank of Northwest Georgia and packed these boxes. Had a team of volunteers and GNTC staff and the Head Start staff. They packed these boxes with fresh vegetables and food from we called it a mobile pantry. Go ahead. And simply the cars would come, they would go through the drive-through, pop their trunk, and we would give them boxes of food, the essential items like diapers, and then also if they had young children, which most did, then they would get the activity kits for the summer. We served over 150 families and over 350 children. And then an additional thing, I want to tell you this real quick, and then we got to get off. This is our Spanish CDA program. This is the first cohort. We've had 2, 30 students in each cohort. And these are students who Spanish is their home language. they have an interest in childcare, but there's not a route for them to get into the early education certificate program at the college, at the technical college, because their English is not strong enough to take classes. They don't feel comfortable doing the classroom work in English. And so we worked with the National Child Development Certificate Program to teach this in Spanish. We hired 2 bilingual teachers that both had experience in early education and went to town. They did completed all their classroom work, and then have gone out now to work, and they have become the workforce in our child care centers. And so it's been phenomenal relationship, phenomenal ways. All of these young ladies are either moms or grandmothers. And so now they all know about the basic child development skills, things like CPR and first aid and what is expected in a child care environment. So we're really thrilled with that program. And that's it. We've thrown a lot of information at you. I hope everyone has stayed with us.
Thank you so much, Suzanne. This has been a wonderful presentation, and we have a little bit of time for questions now. I know that the Q&A box has been very busy with a lot of questions and a lot of questions being answered. So if you saw a question pop into the Q&A box and did not see the answer, go to the Q&A and look in the answered area, and you'll see lots of information about the questions people had. And we can share contact information as well. I wanted to say, first of all, that if you still have a question for the team, you can post it in the Q&A box. We have a little bit of time for questions, but I wanted to start out with one question to the group, if any of you want to answer, about any ways that your program has, making this partnership a priority, that your program has benefited from it, as well as the ways that your program has benefited the overall initiative. Is there anyone who'd like to talk a little bit about? I know Sharon and Michelle talked quite a bit about that, but is there anyone else who would want to let us know a little bit about how the partnership has benefited the program that you're running?
I will say this. I think every person on this presentation, we all share a passion for our community and the families and children, and we all kind of have the same end goal. So if you can align yourself with a group of people who, you've got 2 different school systems, but they all want the same thing for their kids and families. We're all working toward the same end goal. So I think that's huge too.
I agree with that, absolutely. And I'd just like to add, as the person that's coming from the medical facilities in our community, trying to add and talk about how can we help influence reading and help people understand that it's so important to start their children early. Having this incredible group of, just everyone that's been on this panel behind us and helping us and supporting us and telling us, oh, you can do the Reach Out and Read program at your facility. You can start with the Talk With Me Baby at the hospital from the time the babies are born and the families are first formed. All of that was just so helpful in helping us as a medical facility reach out to families to set that example and start early. Start now reading books to your children while they're babies. And then having this incredible team behind us was amazing.
Great. Thanks, Terry and Stephanie. Carolyn, I saw you came on camera. Do you have an answer to that question, or are you just joining us by camera?
I had a couple questions in the question box, and I shared my information. I'm always glad to help people. The Rising Pre-K is a state funded program, and we have to apply for it every year, but it is an amazing summer activity that students have the opportunity. You think, do they really need a Rising Pre-K? But our second language learners need that support and that help to get them ready for pre-K. So it is a great program, and I'll be happy to share lots more information on it with anybody who's interested.
Great. Thanks, Carolyn. Another question for anyone in the group. as you reflect on sort of the path you've taken and where you started, do you have any advice that you would give to communities that are just getting started? Any particular focus to think about at the beginning, or, you know, set of steps that you took that you think would be most helpful for someone who's a new community?
You know, when we started small. I think Stephanie said that, and several people have alluded to that. Don't be afraid to get started. Don't be afraid to ask. The pillars of the Get Georgia Reading campaign were huge for us because it helped everyone. As you can see, our language is the same. Like Dalton Public Schools may call it something different when they're outside or working at Dalton Public Schools, or United Way might call it something different. But we now speak a common language based on that, the framework that Get Georgia Reading and the campaign has given us. And so I think that more than anything, that has been a huge attribute, because we all speak the same language around literacy and around what it looks like for school readiness.
I would add to that, we have done a lot of parent surveys and a lot of asking the community what they want. Every community is different and has different needs and different interests. And so we didn't do a one size fits all. And some of our things flopped. And we just learned from that and went on. And so you have to be willing to ask and learn and reflect on what you're doing and listen to the community.
And I'll add, from a college standpoint, I think one of the things that's worked really well for us is that we know we've listened to what the community wants, and we've participated in those, asking those questions. So we don't come in thinking that we have all of the answers, and we're actually doing the work that we propose. So I think that makes it easier for the schools when we do things like ask for children in the summer. They're willing to give us the children in the summer and go to that extra effort because they know that we have a record of success or a record of following through with what we've asked to do. So I think that that's been beneficial, and that we're always willing to fix our failures. So I think that's something that we have had failures, but we just, as Caroline said, learn from them and then make improvements and go on and try to do it. And we don't give up.
I'll have to add to everything that everyone has said, but I'll say that if you're an organization or an outside agency from the community, it's very important to be present as much as possible. So even when we weren't having events that were focused on PBS Kids or GPB, I thought that it was important for us to show the families that we're invested in the community, that we're not just there to give you PBS Kids resources or, bring our characters with us, that we really and truly want to build a community, close the gap with communities and schools, and be able to assist the community with what they're already doing. I think that it was important for us, I think Caroline said, to really listen to what the families were telling us that they wanted, what they needed, and that needs assessment really and truly helped us. And it's just been an awesome time collaborating with each and every entity of the Dalton community. But I think that started with developing a relationship. So we started with Suzanne and Community Foundations, and then that kind of just spread to the schools and to other organizations within Dalton because of the relationship building. And then families began to trust us and know that we were there to support them.
Thank you, everyone. That's so many great pieces to take from that question. And I really appreciate if someone started with all that advice, they'd be sure to see success, I think. So thank you. There was one last question in the Q&A box. How long do you expect this collaborative program to last, and what will help make it continue?
Forever. Children are born every day in Dalton-Whitfield County and in the United States, and they all need to learn to read. So we continuously, that's been the beautiful part, is that we do not stop. We just keep going. We keep looking at ways to fine tune it. When one funding stream ends, we pick it up with something else. We add to it constantly and tweak it a little bit here, a little bit there as we go. That's been the most the freedom to be innovative has been amazing. And then once it's, you know, people would look at me like, we are crazy. You're crazy. We are not taking books out in the 99-degree weather in the South to summer feeding sites. No one even comes. And then I said, well, maybe those kids will come if we turn it into a picnic-like atmosphere. And guess what? Yep, they started coming, not because we knew they were hungry. We knew they needed food. But when we brought a picnic blanket and some books and some balls and a few little toy, you know, chalk, sidewalk chalk, made all the difference in the world. And before we knew it, those kids were coming outside to get their food, but also to get the books. And we were able to see them and put our eyes on them for anyway. It's just, yeah, we hear a lot of no's, and when we do, we just laugh and say, okay, well, watch us. So anyway,
I think that's a great anecdote and advice to end on. I have to say, it's just been so wonderful to hear how your programs and initiatives go from prenatal and newborn babies through each developmental stage, including strong support for parents. It's really inspiring to hear. And so thank you, all of you in Whitfield and Dalton. And we'll look forward in years ahead to hearing more about the great work happening as well.
Thank you, Jenny.
Thank you. Our last slide will just show everybody the upcoming webinars again, in case you missed it at the beginning. So please feel free to join us again this afternoon at 3 p.m. Eastern Time for Accelerating Equitable Learning Post-COVID, A Few Big Bets Part 2. And then next week, we'll have 2 webinars in the 3 o'clock slot next week. We'll have a webinar, Accelerating Equitable Learning Recovery, District Chiefs as Deciders. And then the following week, you'll have two webinars. In the 12:30 slot, the Parent Coaching to Promote Kindergarten Readiness webinar, which is co-sponsored with the Overdeck Family Foundation. And at the 3 o'clock Eastern Time slot, Tools of the Mind, Key Steps to Create a Culture of Learning. Thanks so much, everyone, for joining us, and we hope to see you on another webinar soon. Have a great afternoon.